And Western Mass News is your vaccine authority, and with several COVID-19 variants now here in the Baystate, we spoke with a local doctor to find out if we should be concerned. We're breaking down each variant and explaining why we shouldn't hit the panic button.
The variants are here, and they are gradually replacing the original strain of the virus.
According to the Centers for Disease Control and Prevention, 3 variants of COVID-19 have been identified in Massachusetts. There are currently 441 cases of the United Kingdom variant, 16 cases of the Brazil variant, and 9 cases of the South African variant. These variants seem to be more contagious. 2 variants have also been detected in California. However, no cases have been reported in Massachusetts yet.
There's going to be more that come along because this virus just makes mistakes as it tries to replicate itself. And most of the variants aren't anything to worry about.
President and CEO of Baystate Health, Dr. Mark Kerouac, tells Western Mass News there's no need to panic as the variants are susceptible to all the same control measures, wearing masks, socially distancing, and administering vaccines as the original strand.
That's all we need to do to get through this. Variants or no variants.
Dr. Kerouac says he would be concerned if a group of people who were vaccinated contracted one of the variants, or if a group of people who previously had COVID got one of the variants. But neither has happened.
None of that has happened with any of the variants. And one of the most important things I would point out is the United Kingdom, which is where this variant got started. And the variant is now the most common isolate from the United Kingdom, has had a 90% reduction in cases, even though they've been combating the variant.
He says this means we just need to continue pushing on with vaccines and following public health measures.
I think it's fairly clear that the vaccines we currently have protect against all the important variants that are out there. That doesn't mean that next week there couldn't be some new variant that the vaccines are less effective against.
And while it's still unknown how long the vaccine will protect against the coronavirus, Dr. Kerouac says he predicts the vaccine will last a few years, saying every 2 to 3 years we may have to get another COVID-19 shot. For Western Mass News, I'm Jordan McCool.